If you're over 50 and you've recently noticed changes in your erections, this could be a warning sign your body is sending you. And most men completely ignore it. But here's the surprising truth. For many men, erectile problems aren't just about sex. They can actually be one of the earliest warning signs of serious health issues, including heart disease. And ignoring that signal could cost you more than just your confidence in the bedroom. Hello gentlemen. I'm Dr. Hannah Cole, and for over 25 years I've worked with men dealing with erectile dysfunction, prostate issues, and age-related hormonal changes. And one thing I've learned from treating thousands of patients is this. Many men dismiss early erectile changes as just getting older. But in reality, those changes can be your body's early alarm system. In today's video, I'm going to show you 5 erectile warning signs men over 50 should never ignore. These signals often appear years before serious health problems develop. And the good news is that once you recognize them, there are simple steps you can take to protect your health, improve blood flow, and restore confidence. So let's begin. Warning sign number 1, weaker morning erections. Now this first sign is something many men overlook completely. Morning erections, also known as nocturnal erections, are actually one of the most important indicators of male vascular health. Healthy men typically experience several erections during sleep each night. These occur because blood is flowing freely through the arteries that supply the penis. But after age 50, many men start noticing that those morning erections become weaker, or disappear entirely. This often happens because the blood vessels supplying the penis begin to narrow or stiffen. And here's why that matters. The arteries in the penis are much smaller than the arteries in your heart. So when circulation problems begin developing, the penis is often the first place where symptoms appear. In many cases, erectile changes can appear 3 to 5 years before heart disease symptoms. The good news? Improving circulation through exercise, diet, and managing blood pressure can significantly improve erectile health. But that leads us to the next warning sign, and this one surprises a lot of men. Warning sign number 2, erections that don't last. Many men over 50 notice something frustrating. They can still achieve an erection, but it doesn't stay firm long enough. This condition is called venous leak, and it's extremely common as men age. Here's what happens. For an erection to stay firm, blood must enter the penis and remain trapped there. But when the veins begin to weaken, blood escapes too quickly. The result? An erection that fades before or during intercourse. This issue is often connected to reduced nitric oxide production, poor circulation, early vascular disease. And these changes are closely related to the same processes that cause heart attacks and strokes. Now here's something most men don't realize. Your lifestyle choices, including sleep, diet, and physical activity, can dramatically influence nitric oxide production. Which brings us to the next warning sign. Warning sign number 3, reduced sensitivity. Now this next issue is something many men feel uncomfortable talking about. Reduced penile sensitivity. Some men notice that stimulation simply doesn't feel the same anymore. This can happen for several reasons. One common cause is nerve damage. Conditions like diabetes, high blood pressure, and chronic inflammation can slowly damage the nerves responsible for sexual sensation. Another factor is low testosterone. Testosterone plays an important role in maintaining nerve sensitivity and sexual responsiveness. As testosterone levels decline with age, men may experience lower libido, reduced sensation, weaker erections. The important thing to understand is that these changes are often gradual, which means many men ignore them until the problem becomes severe. But recognizing the signs early gives you the opportunity to take action while the body is still highly responsive to treatment. And the next warning sign is one that many men dismiss as simple stress. Warning sign number 4, loss of sexual desire. A drop in libido after 50 is extremely common. But when it happens suddenly or dramatically, it can signal something deeper. Low sexual desire is often connected to declining testosterone levels. Testosterone naturally decreases by about 1% per year after age 30. By the time many men reach their 50s and 60s, levels may be significantly lower. Low testosterone can lead to reduced sexual desire, fatigue, increased body fat, mood changes. But testosterone levels are also strongly influenced by lifestyle factors such as sleep quality, stress levels, physical activity, diet. Many men are surprised to learn that improving sleep and exercise habits can naturally increase testosterone levels. But there's one final warning sign that doctors pay very close attention to. Warning sign number 5, slower recovery between erections. Now this final sign is something that happens to nearly every man with age. But when it becomes extreme, it may indicate circulatory problems. After ejaculation, men typically experience what's called the refractory period. This is the time the body needs before another erection can occur. In younger men this may last minutes. But after 50, the refractory period can become much longer. Sometimes hours. Sometimes even days. This happens because the body needs time to restore blood flow, hormone balance, and nerve signaling. But when recovery time increases dramatically, it may signal reduced vascular health. Which brings us to an important point many men overlook. Erectile health is directly connected to overall health. Your heart, blood vessels, hormones, and nervous system all play a role. When one of those systems begins to weaken, erections are often the first place the body shows it. The key thing to remember is this. Experiencing occasional erectile difficulty does not mean something is seriously wrong. Every man experiences changes as he ages. But ignoring persistent warning signs can allow small problems to become much bigger ones. The encouraging news is that many of the most common causes of erectile problems are highly reversible. Improving cardiovascular health, managing stress, maintaining a healthy weight, and staying physically active can make a significant difference. Your body is incredibly resilient, especially when you give it the support it needs. So if you're over 50 and you've noticed any of these warning signs, don't panic. But don't ignore them either. Think of them as valuable signals from your body, signals that give you the opportunity to improve your health and protect your future. Because taking care of your body today can help you maintain strength, vitality, and confidence for many years to come. If you found this video helpful, make sure to subscribe to the channel for more science-based advice on men's health, testosterone, prostate health, and sexual performance. And if you'd like to learn about the daily habits that naturally improve blood flow and erectile strength after 50, watch the next video on your screen now. Your future health may depend on it.